So we do these wellness weeks 5 times per year because the goal of our program is to get you healthy and then keep you healthy. So if you have a health challenge or condition, we do recommend you meet with one of the healthcare professionals here. But once you're healthy, all you do is come to the wellness weeks. Because you come to the wellness weeks, you get exposed to 35 workshops. We do free product demonstrations every day. They're $199 value. We give you free literature, free healthy food, healthcare professionals to answer any of your questions. We have samples. And if you want to buy anything, everything on deep discounts. So pretty good deal, right? So the only thing you need to do is get healthy, stay healthy, and come to the wellness weeks and bring somebody with you. So I also do nutritional consults every Monday. So if you have a health challenge and you want to meet with me to do a lifestyle program, I do those on Mondays. The idea is that we want to look at your lifestyle. So bring in all your medications, all your supplements, bless you, and any testing you've had done in the previous 2 years, bring that with you, and I will customize the lifestyle program for you that day. You will not need to meet with me more than a handful of times. Either you're doing the program and getting dramatic results, or you're not doing the program and you don't want to come back. It's pretty straightforward. So today I want to talk about vitamin D and also iodine for thyroid function and immune function. So here are the options we have for vitamin D. You can do 1,000 IUs in a tablet. You can do 5,000 IUs in a capsule. That's what I'm taking right now. And you can also do 10,000 IUs in a liquid dropper. So liquid, caps, tablet, I don't care which one you do, but based on your score, you should have a vitamin D test done whenever you get your blood work done. You bring that in, I can tell you how much vitamin D you'll need. Most people in Pittsburgh need at least 5,000 a day, and in the winter, 10,000. Because we're not getting outside enough, and if we are getting outside, most people use sunscreen. When you use sunscreen at a level of 15 SPF, you block 99% of your vitamin D absorption. In addition, you got to activate the vitamin D in the body. And where do you do that? In the liver. So if you're on cholesterol meds, you have non-alcoholic fatty liver disease, you eat a lot of fast foods, you're not going to convert the vitamin D from the inactive to the active version very efficiently. So we generally need some type of supplement in our program. And that's what we're talking about here, that, it's well known that vitamin D and sun exposure are inversely affected. So the closer you live to the equator, the more vitamin D levels will go higher, and your prevention of any of the autoimmune conditions and any immune dysfunction goes up. So the closer you live to the equator, the more prevention you get. The further away you go from the equator, the higher your risk factors are for any immune dysfunction and all your autoimmune conditions. So what's an autoimmune condition? RA, right? Rheumatoid arthritis, IBS, Crohn's, colitis. These are all autoimmune conditions. So doc says they don't exist in that it's not a disease you caught. Something is affecting your immune system. Our experience is generally something you're eating or drinking is affecting your immune system. Because where are most of your immune cells? If you learn anything today from this workshop, learn this. 70% of your immune cells are located where? In your intestinal tract, in the gut, right? Preferably in the small intestinal tract. Why would they be there? Because that's where, if you're going to be exposed to anything, that's where you're going to be exposed to it, right? Things that you ingest voluntarily or involuntarily. So vitamin D, or 25-OH vitamin D, controls macrophage and monocyte activation. What is that? It's your immune system. When your vitamin D level is below 25, you do not activate macrophages. So you can see now how someone who's low vitamin D level is at high risk for autoimmune conditions because your immune cells aren't working right. It's like the radio dial is in between stations. We got to dial it back in. You don't rip the radio out, right? Conventional medicine wants to shut down your immune system. Not a good idea. So when you see these commercials for maybe psoriasis, and it says you're at risk for what? Cancer, autoimmune conditions. That's why, because they want to shut down the immune system. Now you're at risk for everything. So follow me on this one, okay, folks? This one will keep you awake, I hope. Here's your vitamin D level at the top. Anyone have their vitamin D tested? What was it? Make a number up.
It was low. It was within the range, but
Okay, the range of the doctor, right? They're going to tell you 30 to 50 is great. Not a good idea to follow their lead on that, okay? So, say he got 50, all right? So here's his vitamin D level. And then all cancers combined, he has about a 50% prevention of all cancers when his vitamin D is at 50. What about when your vitamin D gets to 70 or even 55? 75% prevention. So you can actually prevent chronic disease when your vitamin D levels are higher. Why? Yes, ma'am.
I can't read those things on the left column. It's too small. Could you read that column so I can...
Yeah, we'll get there. Okay. So on the top is your numbers, right? Your vitamin D number. And on the left is the disease that we're trying to prevent. So we got cancers, breast cancer, ovarian cancer, colon cancer, lymphoma, diabetes, fractures, falls, multiple sclerosis, right? So all the way down. It's actually in your handout too. I don't know if you can read that one. So these are various diseases that we are seeing what is the prevention rate when vitamin D levels go up. Make sense? Dr. Edwin Lee, who's an MD endocrinologist, right, and a functional medicine doctor. Very interesting because most endocrinologists do not do integrative medicine like he does. He did his residency at Pitt, and he currently practices in Orlando, Florida. He's one of our clients. And what Dr. Edwin Lee says, when vitamin D levels get to 70, he doesn't see autoimmune or cancer. So his goal is to get all his patients over 70. Yes, sir.
that was my next question was, what is the optimum level of, your vitamin D level?
I would say 70 is a good number, right?
So what you just said.
Yeah, 70. How about 80? Not enough. No, 50 is better than 10, right? So it's not all bad if you're at 50.
Percentage, or when they do this test, it's a percentage, or
It's just a score they're assigning. I'm not that concerned with that. What that means, it's just they're going to tell you 30 is what you want to achieve. I'm telling you 70 is what you want, or higher. Toxicity doesn't kick into at least 100, and some studies show 150. I've only seen one person in 12 years working with Doc that had over 100, 103. Okay, so there's no concern with toxicity. However, it was only a short time ago. How much vitamin D a day would they tell you to take? 400, right? Now we're talking 10,000. What did the medical doctors give you in Pittsburgh? Anyone get vitamin D levels? Anyone get vitamin D prescription in Pittsburgh? No one here has got vitamin D prescribed to them. Okay, let's make it up that somebody did, because a lot of people have. They're given 50,000 once a week, which is about 7,000 a day, right? So the MDs are given 50,000 once a week. Only a few years ago, 400 was high. And what they found is vitamin D now is not really looked at as a vitamin anymore. It's looked at as a hormone-like substance. What do hormones do? They turn things on and turn things off. Like testosterone tells your body to produce muscle, increase libido, increase strength, right? Vitamin D now is telling your immune system to work. So there's a lot of research behind vitamin D showing you that, one, you can do much higher doses than we thought previously was possible. And secondly, you need much higher levels than the 30 that they're out there promoting. Now, 30 is not bad. When you get under 25, what happens? Your immune system does not turn on, right? Remember that. Your immune system needs to be activated. So you got to look at vitamin D metabolism and tissue expression. So it's a little more technical, but look at all the cells that are activated by vitamin D. Immune, prostate, breast, colon, neurological. Oh, is anybody concerned with those? right? Because if you're a male and you live long enough, 1 out of every 2 of us will get prostate cancer. So there's 6 of us in here, 3 of us will get prostate cancer if we live long enough. A lot of females are getting breast cancer, right? Colon cancer, these are all on the rise. So vitamin D actually can help prevent these types of conditions when it's at a high enough level. It also controls over 200 different gene activities in the body. So vitamin D, more than just a vitamin, hormone-like substance, and you'll start seeing that in a few years in the paper or magazines. Remember, you heard it here first. Here are some of the conditions associated with suboptimal vitamin D levels. Look at the different categories we can help with. So all the different cancers we just went over. Autoimmune conditions, RA, Crohn's, MS, endocrine, all the hormonal issues that people are suffering with. What about musculoskeletal? Well, we've always thought of vitamin D for what? The brains and the bones. If you're depressed, take vitamin D. If you have a fracture, take vitamin D. So now, never more true than now. So neurological, cardiovascular, so you can see how so many different diseases are affected by vitamin D because what? It turns on 200 different gene activities in the body. So let's go back to that example I used earlier because a picture's worth 1,000 words, right? So I said the closer you get to the equator, the more you can prevent disease. The opposite is true too. The further you get away from the equator, the higher your risk factor. So this just looks at MS. So right about where we are right now is where you start getting to the high risk area, where if you're down in the Carolinas or down in Florida or Mexico, you dramatically reduce your risk. You hear people that move to Florida and suddenly they feel better? Yeah, it's right. Now I know it's a lifestyle, but it's also the sunlight. It's the activity. It's the body moving. It's the better food. So you can change how your body responds just by changing your environment. And that's an example of it. A friend of mine had scleroderma. What is scleroderma? Autoimmune. They gave him 18 months to live. So I started working with him, put him on a cleanse, had him start juicing. And his mom lived in the Panhandle of Florida. I said, you're on disability ready. Go live with your mom for 6 months and see how you do. That was 12 years ago. Yeah. He's healthy as a horse right now. Outlived the doctor's recommendation to him, which was only 18 months. And he's only on one medication, where at one time he was on a picnic basket full. So, folks, you have control of your health. It's the environment more important than the gene. How do we know this, right? So if you have a sibling, today's a bad example, it's not sunny out. But if you have a sibling and one of you stays inside, the other one goes outside and is in the sun for 3 or 4 hours, their skin's going to change color, right? And then they come back inside, and one is not changed, the other one is changed. Has your genes changed at all? Has your genetics changed? Yes? How did genetics change? No. Yeah, the genes, you didn't change your genes. You changed the environment. Yeah, your genetics didn't change, did they? No. The environment did. So remember that. It's not your genetics. You can't change your genetics. You can only change the environment they're in. And that's a very simple experiment, but you can do that for many different things. Smoking, alcohol, fast food, workouts, whatever it may be. You can change the environment. You change how the genes act. So we talked about living at the higher altitudes. Type 1 diabetes, Crohn's, living below that altitude for the first 10 years of life reduces your risk of MS by 50%. That's just where you live for the first 10 years of your life. So you get more vitamin D for the first 10 years, you will reduce your risk by 50% of MS. We've helped people with MS. And one of my clients, Conan Shaw, he's a nutritionist north of here. He has 17 or 18 documented cases of MS that he's fixed. Yep. So you look at also the MS patients given 5,000 IUs of vitamin D3, 600 milligrams of calcium for 2 years. Reduction in symptoms, no adverse events. RA and OA, so rheumatoid arthritis and osteoarthritis, right? 2 different types of arthritis. A woman consuming more than 400 IUs a day have a 40% reduction of developing these conditions. That's just 400 IUs. So you see how vitamin D can help so many different conditions out? Oh, I love this one. Yes.
A friend of mine has RA. It already been diagnosed like for 10 years. Is there a chance for you to reverse that? And the same
If
with
he,
ALS?
well, hold on a minute, one at a time. So he has what, RA?
RA.
Yeah, he can reverse it, absolutely, yeah. How much we reverse it and how well he does, everyone's different, and what he's willing to do and what he's done so far. So everybody's different. ALS, is that the second one you said?
Right.
You know, that's probably a lot more challenging than the RA in my opinion. But it doesn't mean it can't be fixed. But that one is very challenging. It depends on where people are, you know. If they have had something for 30 years and they haven't done what they're supposed to do, it's harder to help them. But as long as they're compliant, they will see some kind of results. How much? We don't know, but get them in here. So this is interesting because this looked at low vitamin D levels correlated with inflammation, CRP, interleukin 6. These are inflammatory markers that lead to what? Heart disease, right? Cardiovascular disease. So they said low vitamin D levels are independently associated with all causes and cardiovascular mortality. So if you have cardiovascular disease and you have low vitamin D levels, you can die from anything at a much greater rate. So living at higher altitudes reduce the risk of hypertension and cardiovascular disease. Low vitamin D levels associated with congestive heart failure. You guys get the idea, right? I was really shocked when I was doing training on this because I never thought of vitamin D for cardiovascular disease. That was the last thing I expected. Hypertension. But these are all published research studies that are out there. So vitamin D really endocrine, we say suppressor. So you look at overall, it can help with blood pressure, similar as some of the angiotensin medications. It works in a similar fashion. And same thing with cancers. We went over this already. And fast forward a little bit here. So these are different pictures that illustrate. This is cancer rates for breast cancer from 70 to 94, higher latitude, and then higher risk and higher rates. Same thing with ovarian cancer for females. This looks like prostate, same thing. You know, very little do you see below the latitude lines when you get down to the Carolinas and further down. It doesn't exist. The rates are much, much, much lower. You do have some cases, but not at the aggressive rates you see elsewhere. Now, this is interesting. This is, without getting too technical, when they go below 20, macrophages cannot initiate a response. So when vitamin D levels get low, the immune system doesn't work well. Okay? Blood sugar dysglycemia. So where do we get vitamin D from? Fish would be a good place, right? Fish, nuts, seeds, egg yolks. What else up here? And of course the sun. That shows you how you get vitamin D in. So if you're out in the sun, do not use high levels of sunscreen. Some people use the Miracle 2 gel. That works really well for me. I didn't have to use sunscreen. What I do is I go out a little more each time, and I don't use it. Unless it's the first day I'm out, and I'm out for a long period of time, I will use a little bit. What I like to do is go out for a half hour, 45 minutes, and put the shirt on, because I'm at the pool as much as possible in the summertime. That's what we're talking about, right? Doc, I go in the sun, so I don't need supplements, right? Latitude above 40, your conversion is dramatically reduced, and you're not going to get it in the winter months. So we looked at vitamin D, we look at iodine more than just for thyroid. Iodine is used for autoimmune conditions And here's a list of them. So, fibroblastic breast disease, diabetes, hypertension, Graves' disease. You need T4. Thyroxine T4 contains what? 4 iodine atoms. Anyone here ever heard of T4 before? You guys heard of T4? T4 is your inactive thyroid hormone. Inactive. It's like the ingredients to bake a cookie. You have ingredients and you have the cookies, right? You have T4, which is the ingredients, and T3 contains 3 iodine atoms. It's in the name. So what do you need to convert T4 to T3? Iodine. So you convert this actually in the gut, and your body will store about 20 to 30 milligrams of iodine and about 8 in the thyroid gland. That's why we're showing you this, because we can take higher levels of iodine than people may think. So you have different things that are essential. So we use sodium iodine transporters, and you look at this, right? You say, well, why is that important? Because we have in ours selenium, which is important for conversion. So we have T4 and T3. T4 is inactive, T3 is active. You must take T4 and convert it to T3. What do you need to convert? Iodine, iodide, selenium, and tyrosine. That's what we have in the iodine plus. Do you guys see now why we have those ingredients in there? It helps with the conversion. Anyone on Synthroid? Nobody's on Synthroid?
My daughter.
You're a doctor?
My daughter.
Your daughter. Okay. Yeah. Synthroid is T4. Okay? So some people are on T4, the Synthroid, and they don't convert it very well to T3. So it may not help them. They can still use iodine plus with the T4, the Synthroid. Okay? To me, what would make more sense would be to do T4 and T3. What's that? Armor thyroid, anyone have Armor? Or Nature's thyroid? That's T4 and T3 together. Okay? Makes sense? And there it is right there. T3 conversion selenium. Selenium deficiency inhibits the conversion of T4 to T3. So you need selenium to convert. So if she's not converting it well, is not doing well on it, that may be why. You need to have that ingredient in there to help convert. I know I'm going fast because of the time. What they found is increased TSH levels, what's that? Thyroid stimulating hormone, right? Are found due to iodine deficiency. Which leads to iodine deficiency, thyroid dysfunction, and ADHD. So due to time constraints, I'm going to have to cut this one a little bit short. Any questions on this at all? Yes.
Can, if iodine is given and selenium, can the need for synthroid be eliminated?
It could be, yeah. Yeah, absolutely, yeah.
It could be, she
Yeah.
might just have, she has very minimal early detected hypothyroidism. Could it be because of selenium deficiency? Or
Absolutely, yeah. That's why we're showing you this, yeah.
what should we check the levels of selenium and iodine, or
You could have just given the iodine plus.
give her that?
Yeah, $20 a bottle. Give it to her.
Stop the synthroid and give her
I'm not saying to stop the Synthroid, but if she's not getting great results on the Synthroid, add the iodine plus in.
she's getting good results.
Oh, she is? Okay. Yes. Lack of vitamin D, you can have what? Well, there's a good start. Here are conditions associated with suboptimal vitamin D levels. So you have any of these conditions right here: high blood pressure, obesity, Crohn's, autoimmune conditions, MS, cancer. There's a pretty good idea you have low vitamin D levels. Okay? Any autoimmune condition is going to have low vitamin D levels. Chronic infections, mood disorders like depression, chronic fractures. But why not get the vitamin D checked? It's the same blood work. You don't got to do anything differently other than ask the doc, hey, doc, can you please test my vitamin D when you're doing the other tests? What if they say no?
Find another doctor.
Thank you. Very good. Smart guy. Go to another doctor. I'm tired of these doctors, bullying people and being disrespectful. Why? Because they went to medical school? Big deal. Just like there's great mechanics and there's terrible mechanics, there's great doctors and there's bad doctors. So, great questions, though. You guys are really keeping me on my toes. Yes?
I want to say how much I appreciate this topic. It's a new topic. I've never heard a whole talk on vitamin D. Maybe you've done it on a day I wasn't here, but so it was cut short today. I would like to see it come up again until we've seen it enough to understand it.
We will bring it back for the Winter Wonderland next workshop.
Thank you.
Yes, thanks, sure.
We didn't talk about Agent Orange yet, right? I'm a veteran. I got Agent Orange.
We could,
Gonna help me?
that'd be a good one for Doc to handle. Yeah.
Yeah, I already talked to him, but he's been so busy. I'm gonna have to come back.
No, I mean, we'll have a topic maybe on chemicals and different things that people are exposed to, but it's a great topic too, right?
D3's gonna help me. I'm taking it. I've been taking it.
It's going to help your immune system.
Yeah.
I can't guarantee it's going to clear all the Agent Orange out of your body, but yeah. There's other things I would do for you too. Like, you want to write these down? D3 would be at 10,000 a day. Live Clear 2. 2. That's 3 per day. 3 per day, yeah. Greens, lean greens.
I got 8 and 1 green.
Good.
Every day.
Yes, and then Immunomax, IMMUNOMAX, Immunomax capsules, 3 per day. All right, folks, we're still doing the heavy metal testing for the next hour or so. If you want, you can sign up right here. I'm still doing testing, so if you want, sign up. I appreciate all the support. And next speaker will be on in about 10 minutes, okay? Thanks, guys.